Man, that's impressive lateral hip strength, Fred. You might be surprised given Fred doesn't have the best weightlifter's physique, but he has really good lateral hip control of his IT band and gluteus medius muscle. That's really important because Fred used to suffer a lot from greater trochanteric bursitis and back pain. But once he figured out how to stabilize his hip, that doesn't seem to bother him anymore. Fred, do you mind showing me what you did to make those hips feel a little bit better? In addition to the other video that I did on hip pain, this is a method called 7-way hips that I've borrowed from physical therapists. A lot of us are lacking strength and stability in the side of our hip. And what that means is every time we walk, our hips are shifting, and that can hurt the bone here on the side of our hip and pull on our lower back. So what we want to do is wake up the muscles on the side of the hip, make them a little bit more strong, and gain some control over them. So there's a series of 7 leg movements that are going to help us do this. So step 1 is just lie comfortably on your side. As if you're standing up, you want to have a straight line between your ears, shoulders, hips, and ankles. And you can do this lying on the couch or the floor, wherever it's comfortable. And step 1 is, can you just hold your leg parallel to the ground for a few seconds? 5-10 seconds. Give it a break. Lift it up. 5-10 seconds. Give it a break. If that's starting to feel good and easy, then we would do some knee to chest maneuvers, keeping our leg parallel to the ground. Imagine there's a table that you're just sliding your leg over the top of. Bring up and down. Can we do this 10 or 15 times? Number 2 is bending our knee backwards and then trying to push it to the back wall. So again, sliding on that table. I'm really not trying to arch my back. I'm just pushing, using my hip muscles to push my foot to the wall. You don't have to move very far. The trick is more or less to move your hip, but keeping it flat to the ground like so. If doing it with a bent knee starts to become easy, then we move on to the straight leg raises. Similar to the first exercise, how far forward can we bring our foot before, our hamstrings tighten up? We don't want to arch our back or bend our back to get more out of it. Keeping a nice neutral back and belly, bring it up, bring it back. 10, 20 times, same thing. Kind of point your toes and try to reach for the far corner. 10, 20 times. Now we're going to do some bicycles. So we bring the knee up, just like our foot's on a bicycle pedal. Very important is to know how to make your body do smooth circular movements. By 10, 20 times, then we reverse it. We want to stay symmetrical. 10, 20 times. Then we're going to do what I call Jane Fondas or leg lifts. This is showing my age a little bit. We just bring our leg up as high as we can, hold for a breath, and lower. High as we can, hold for a breath, and lower. For bonus points, to get a nice stretch out of this, we can bend the bottom leg and then let our knees touch so that we get a little bit of an angle in the hip. So we bring to parallel, hold for breath, high as we can, hold for breath, bring to parallel, hold for breath, knees touch for a breath. Can we get 10 to 20 of these guys? Then we can do some zigzags where we, with 3-inch movements. We just foot forward and back till we get as high as we can, and then back down. And then lastly, holding it parallel, we do a few forward circles and a few backward circles. Now, I'm already just doing a few of these, getting a pretty good pump in these muscles. So take a break when you need to. You don't need to do them back to back. Listen to your body, rest when you need to. But for each exercise, try to get 10 or 20. You might do, for example, 10 or 20 knee raises, and then switch sides, because again, we want to keep things symmetrical, and we do 10 or 20 on this side. That way we're staying balanced and not burning out one side of the body as we swap back and forth and do our exercises. So 7-way hips, this is going to help a lot with hip and back pain, especially trochanteric bursitis.